Silicone dressings. Silicone dressing was first successfully developed by Long-Term Medical in Asia in 2012. That is soft silicone polymer dressing. Long-Term Medical is one of the few manufacturers which can produce silicone dressings in the world. It has earned plenty of domestic and overseas patents. Silicone dressing can be applied repeatedly. It is gentle and elastic. It can fit tightly to both surface skin and deep pore. As a result, increased contact area enhances the paste. When it is torn off, silicone dressing can scatter tension on a larger area. It can be released gently without epithelial cell damage. It will protect fragile skin and new epithelial tissue and reduce pain to minimum. Clinical trial shows that long-term silicone dressings have the following characteristics. 1. It keeps skin moisturized for wet healing. 2. It passes gently without hair pulling and no new epithelial tissue and granulation tissue damage. 3. It does not stick to the wound bed. No pain during dressing change. 4. It restrains scar formation. 5. It can be applied repeatedly. 6. It is soft, hypoallergenic, and breathable. Other than these, long-term silicone dressings are also waterproof, high absorbency, and low re-wet rate. A current rate of pressure sores is required to be 0 in hospitals. How to prevent long-term bedridden patient and a special patient from suffering pressure sores based on current nurse-patient rates. Long-term silicone dressings are your best choice. Long-term silicone foam dressings brings the following benefits. It can reduce compression to minimum. At the same time, it doesn't influence breadth of skin. Silicone dressing doesn't need second adhesive dressing comparing to regular foam dressing. It doesn't cause second damage comparing to self-adhesive foam. Comparing with hydrocolloid dressings, silicone dressings can be adhered better without hair damage. It doesn't tear epithelial cell and protect fragile skin and protuberance of bone and renaissant skin around wounds. The feature of repeatable application makes wound observation easy without changing dressings. Thereby, one piece of silicone dressing would be used up to 10 days. It makes more cost-effective and also more effective on preventing for pressure sores than hydrocolloid dressing and regular foam dressing. According to actual clinical needs, Long-Term Medical has developed different types of silicone foam dressings, such as foot dressing, sacrococcygeal dressing, hip dressing, scapular ridging dressing, children occipital dressing, and adult occipital dressing, etc. Long-term board silicone dressing has a special 5-layer structure. The first layer is a silicone layer. It gently applies to skin around wounds and creates closed environment for wounds. Wound exudates pass through small holes on silicone layer. The second layer is a foam-absorbent layer. Exudates stay here for a little while and then are transmitted to the third layer. The third layer is one-direction diversion layer. It can transmit exudates to the next super-absorbent layer. The fourth layer is a super-moisture locking layer. It can reserve plenty of exudates. The fifth layer is a high-permeable PU film layer. The moisture is evaporated through the PU film and make waterproof and permeable. Comparing with normal foam dressing, board silicone foam dressing can prevent excess exudates soaking wounds effectively. Long-term silicone foam dressing is applicable for decompression of fragile skin and prominence of bone. Bedridden patients, inactive patients, paraplegia patients, primary and secondary pressure cause, prevention of pressure cause for patient during operation, ICU, chronic wounds, wounds with fragile skin around, ulcer of lower limb, cancerous wounds, pyoderma and pressure cause, painful wounds, radioactive damage. Silver silicone dressing. Long-Term Medical has developed silver silicone dressing. It provides a better choice for chronic wound with long-acting and broad-spectrum antibacterial dressing for combining all advantages of silicone and silver iron. Applicable range: various chronic wounds, delayed healing wounds, shock and infection stage of burns, dressing change after implantation operation, dressing change after contamination operation and infection operation. Contact silicone dressing. Contact silicone dressing is soft and transparent. It doesn't paste to wounds. No pain dressing changing. It can promote drainage, prevent abnormal growth of granulation, and restrain scar. Applicable range: skin damage, donor site and receptor site of a skin grafting patient, wound without full thickness defect, formative period of granulation, painful and sensitive wounds, that is, wounds after prepuce operation and perianal operation.
Silicone tape. Silicone tape is for external use and can be applied to fragile or otherwise challenged skin, such as chemotherapy patients, dialysis patients, and neonatal patients. It can also be used for external fixation and protection of various catheters, electrodes, and dressings. This product is waterproof, permeable, hypoallergenic, and repeatedly adhesive, with no skin damage.